Hospitals across our region are beginning to lift their mask requirements. This comes after President Biden signed a bill on Monday ending the COVID-19 national emergency. Healthcare administrators tell our Stoker Wieczorek why they're choosing to continue requiring masks and why some are making them optional. Stoker.
That's right, Sean. The Republican-backed bill states that the pandemic emergency is over roughly a month earlier than what the Biden administration had originally planned. Local healthcare officials are sharing their reaction.
It is recommended that hospitals use masks in patient-facing areas if the county's community transmission is high.
That's what Conemaught's chief medical officer, Dr. Elizabeth Dunmore, says the CDC recommends even after the COVID national emergency was declared over by President Biden.
We bounce back and forth between high and substantial and sometimes even moderate, but because that changes from week to week, we have assessed the most prudent way to proceed is just continue masking rather than saying 1 week you're masking, 1 week you're not.
Chief Quality Officer for UPMC West Central, Dr. David Burwell, says they also are continuing to wear masks and practice COVID hygiene. He says this is similar to what they would be doing if the pandemic didn't happen.
We are doing a couple changes. We do allow our patients and our support staff and visitors, while they're alone in a private room, in order to, they may remove their mask at that time.
Meanwhile, other hospitals are lifting their masking mandates. Mountain Indian Health released a statement saying, quote, patients and visitors are no longer required to mask except when symptomatic or COVID-19 positive. Visitation will return to pre-pandemic policies and spaces such as the cafeteria and its capacity. Nittany Health Chief Medical Officer Upendra Thacker says, quote, we will continue to monitor the COVID-19 situation and CDC state and local requirements and make adjustments in the future if necessary. Geisinger also released a statement saying, quote, we have begun easing masking restrictions in our hospitals and clinics. Employees, patients, and visitors will only be required to wear masks during interactions with their care team in patient care areas.
Administrators also say apart from the changing hospital climate, their operations remain unaffected. Reporting live in the studio, Stoker Wieczorek, 6 News.